On the Health Watch this morning, at the height of the coronavirus pandemic, many people turned to vitamins and supplements in the hopes of boosting their immune systems. Vitamin D was one of the most popular, but now a large-scale study shows no evidence that taking vitamin D actually reduces infection rates or the severity of COVID-19. Joining us now to break down this new research is the Fox Medical team's Beth Galvin. Beth, good morning. Good to see you this morning.
And good morning, Danielle, to you.
All right, so you know what? This probably is surprising, right, for a lot of people who did take vitamin D. What did this study look at? How did it come to this conclusion?
So these are researchers at Canada's McGill University, and what they did was they compared genetic information on people who contracted COVID-19 and became sick and those who did not contract COVID-19. And what they found was that there was really no evidence that vitamin D helps protect people from either becoming infected with COVID-19 or from developing severe complications from it. They just found that, vitamin D levels didn't play a part in a person's risk of becoming severely ill or being hospitalized.
And so where, Beth, do you think this came from, that vitamin D could actually help?
Well, I think, in the beginning, there weren't any effective treatments for COVID-19. And so researchers were sort of looking at everything that we have. And we know that vitamin D is very important in immune health. It's very important in bone health. So naturally, researchers were looking to see, maybe vitamin D, especially in people who might be low in vitamin D, giving them supplements or boosting their vitamin D might help their immune system fight off the virus, might help keep them from developing complications. What these researchers found, looking at sort of genetic information about people who were infected and not infected, was that it just really sort of didn't pan out as an effective treatment. And so much so that they really said they felt like going forward, we ought to be putting our money and time into more promising therapies that may actually have some therapeutic value, that they really felt like vitamin D might be sort of a dead end.
And so when we look at other supplements, and let's say vitamin C, for example, which is another one that was touted as maybe effective against possibly helping against COVID-19, what about something like that? Because I think a lot of people are going to be still looking at these supplements, right, moving forward in terms of taking whatever they can to help.
Well, I think overall, making sure that you have, that your levels you're not deficient in anything. I don't really know that we've effectively seen any supplement that would lower your risk of contracting COVID-19. I mean, I think the best thing that we have is the vaccine against COVID-19, the best way to protect yourself. And then the second best way to sort of supplement that is to wear a mask when you're in public situations and to try to stay out of crowded indoor settings at this point. And physical distancing too, but there just hasn't been really a magic bullet when it comes to vitamins to say, making sure that you're getting this vitamin will help you, fight off a potential infection with COVID-19. Unfortunately, we just don't have the science that backs that up at this point.
All right, Beth Galvin, thanks so much for joining us.
Thank you, Danielle.
Absolutely. It is now 9:19. Let's get on over now to Fox 35 Storm Team Chief Meteorologist